Hey, welcome back. Today we're jumping into something truly amazing in the world of cancer treatment. We're going to talk about a minimally invasive therapy for localized prostate cancer that is completely changing the conversation by focusing on fighting the disease without taking away your quality of life. Just think about that for a moment. For so many people, a cancer diagnosis isn't just scary because of the disease, but also because of the fear of what the treatment will do to their life. But what if? What if we could take out the cancer and leave everything else just the way it was? Well, that's exactly the promise of the therapy we're talking about today. And that leads us right into our first big idea, finding a gentler way forward. See, this isn't just about a new piece of tech. It's really a whole new way of thinking about how we treat cancer, one that's all about precision, not just power. You know, for the longest time, the approach to prostate cancer was pretty aggressive. It usually meant either surgically removing the whole gland or hitting it all with radiation. And yeah, those methods can be effective, but they also come with a high risk of some really serious, life-changing side effects for urinary and sexual function. But now, there's an approach called focal therapy. And honestly, the best way to understand it is to think of it like a lumpectomy for the prostate. Instead of taking out the entire organ, doctors can go in with incredible precision and destroy only the cancerous part. This is a huge, huge shift in thinking. So, how in the world does this actually work? I promise this isn't science fiction. It's what happens when you combine really powerful imaging with laser-focused precision. Let's break down exactly how it's done.
It's really a four-step marvel. First, a super detailed 3D MRI map is made to find the exact, and I mean exact, location of the tumor. Then, a tiny little laser fiber is guided right to that spot using the MRI in real time. Step 3, the laser heats up and just destroys the cancer cells. That's a process called ablation. And then comes the final, most important step. A special cooling system protects all the healthy stuff around it. That last step, well, that's the absolute game changer here.
And that cooling system brings us to what is, honestly, the most important part of this whole story, protecting your quality of life. Because the goal here isn't just to get rid of the cancer, it's to do it while keeping all those essential daily functions completely intact. This cooling protection really is the secret sauce. While that laser is doing its job on the tumor, this system is busy cooling down all the delicate parts nearby, things like the urethra and all the critical nerves needed for sexual function. It's basically a thermal shield, preventing any collateral damage. And when you put these two approaches side by side, the difference is just wow. On one hand, you have the traditional whole-gland treatments that risk damaging a lot of healthy tissue. But with focal laser therapy, the entire goal is to spare that tissue, to preserve normal urinary and sexual function. It's a night and day difference. Okay, so this all sounds fantastic, right? But does it actually work? Let's take a look at the data from early studies, because the numbers are incredibly promising. Let's talk about effectiveness first. We're seeing a 90 to 95% success rate in controlling the cancer right there in the treated area. For men who have low to intermediate risk cancers, that's proof that a much less invasive approach can still be incredibly powerful against the disease. Now, what about those side effects we've been talking about? Well, the risk of urinary incontinence is reported to be less than 1%. Think about that. Compared to the risks with traditional treatments, that is a massive improvement and a huge relief for patients. And sexual health? For men who had normal function going into the procedure, the risk of having significant long-term erectile dysfunction is only about 2 to 3%. Again, these are just remarkably low numbers, and they really speak to how precise this therapy is. And the good news just keeps coming. This is usually an outpatient procedure, meaning you can often go home the very same day. Recovery is much faster, there are fewer side effects overall, and, get this, if cancer ever showed up in a different spot later on, the treatment can often be done again. So, with all of this amazing potential, you're probably asking, okay, is this treatment right for me? And that is a really important question. Generally, this treatment is best for men whose cancer is still contained inside the prostate and hasn't spread. It's really designed for those with low to intermediate risk disease, where this super targeted, less aggressive approach just makes the most sense. Now, of course, we've got to be realistic here. This is still what we'd call an emerging therapy. We definitely need more long-term data to see how it holds up over many, many years. It also takes a very specialized medical team and some advanced equipment, so it's not available absolutely everywhere, at least not yet. So what's the big takeaway from all this? It's that medical science is giving us powerful new choices that put your health and your quality of life on the same level. If you or someone you care about is facing a diagnosis of localized prostate cancer, the single most important thing you can do is talk to your doctor and ask about all the options, including this one. And just as we finish up, here's a quick and important reminder for everyone. Always be sure to prepare your food safely. And if you want to keep up with more medical breakthroughs and health facts just like this, make sure you follow healthtalk.org. Thanks so much for tuning in.